Hi, I'm Heidi, and this is Sam and Allie. We're from Parkland's Occupational Therapy Assistant Program, and we're going to be talking to you today about car safety. Transferring in and out of a car is a common daily activity that should be done correctly to avoid stress and strain on your spine. The common way people get into a car is by putting one leg in, then sitting, and then putting the other leg in. When we are young, this is not much of a problem. As we age, or if we are helping an older adult get into a car, this is not a safe way to transfer. Driving in community mobility is defined by the Occupational Therapy Practice Framework as an instrumental activity of daily living, or an IADL. IADLs are the activities that allow a person to live independently. They are the activities that a person does to take care of themselves and their homes. As occupational therapy practitioners, it is our job to help our clients engage and participate in all areas of occupational performance. First, we will demonstrate a safe way to transfer to and from a car. Step 1. Open the door and turn your body so that your back is facing the seat. If you have an assistive walking device and are traveling with someone else, you may hand them the device to place in the trunk or the back seat. If you are traveling alone, you will have to place it in the trunk or the back seat yourself. Step 2. With your back to the seat, lower yourself down to sit on the seat. Be sure to avoid bumping your head on the car when sitting down. Step 3. Once sitting, turn your body toward the steering wheel, lifting in one leg at a time. Step 4. Once you are in, shut the door and make sure to fasten your seatbelt. Step 5. When you arrive at your destination, remove your seatbelt and open the door. Step 6. Move one leg out of the car at a time. Turn your body so that you are sitting on the side of the car seat. Step 7. Use your arms to push up off the seat to standing. Make sure not to pull on the door. If another person is traveling with you and you have an assistive walking device, have them get the device ready for you before you stand. If you are traveling alone, you will have to retrieve it yourself.
Now that we've talked a little bit about transferring, I will be showing you some adaptive equipment that can be used to assist with car transfers or to help while you are driving. Transfers can be difficult to perform for a variety of clients. Adaptive equipment is a reasonable and accessible intervention for anyone who struggles with mobility while getting in and out of a vehicle. Handy bar. This type of adaptive equipment is beneficial for adults with poor balance but who are able to use their upper body, arm strength, and hand strength to stabilize themselves and pull their body in and out of a vehicle. Locate the U-shaped striker on the vehicle door frame. Insert the handy bar firmly into the striker. Use the handy bar as a support. Swivel seat. A swivel seat can be used for adults with difficulty turning their body to enter and exit the vehicle. The swivel seat allows a person to enter a vehicle and swing legs into the proper position in 2 separate, easy movements, with less overall strain on their body. Colored glasses. Colored glasses can be used for individuals with vision problems to reduce glare, increase visual contrast, reduce eye strain, and improve vision at nighttime. Yellow lenses are optimal for improving contrast at night and making the roads and cars appear brighter even in the dark. These may be especially beneficial for people with glaucoma and cataracts. Orange-colored filters or glasses can help with low contrast or sensitivity conditions, especially people with macular degeneration. This color helps to increase contrast for these individuals in low light conditions, like driving on a foggy, cloudy, or rainy day. Amber and plum-colored glasses help reduce glare from lights or the sun. This color is especially useful for people with diabetic retinopathy. Be sure to check with your eye care professional first in order to determine what lenses are best for you. Extended or wide rear view mirror. An extended rear view mirror gives you a wider view of the traffic behind you, which can decrease the blind spot. Using an extended rear view mirror may be helpful for people who find themselves losing cars in the rear view mirror often or trying to change lanes when someone is too close behind you. This can be a very helpful tool. However, if you do use one, you must make sure that it is not so big that it is preventing you from seeing out the front of the vehicle through the windshield.
One of the simplest ways to maximize safety while driving or riding in a vehicle is ensuring that you are seated correctly in the car and all of the components of the car are at a safe distance.
The steering wheel should be approximately 10 inches from your chest or far enough away that your elbows can bend a little and your arms can be relaxed while holding the steering wheel. The face of the steering wheel should be in line with your chest. This is important so that if the airbag does deploy, it will hit your chest and not your neck or face. The seat should be positioned so that you are sitting upright. Your seat should be close enough to the steering wheel to maintain the distance we just talked about. Your seat should be at a height that allows you to see over the steering wheel and clearly out the windshield. The top of your head, or at least the top of your ears, should line up with the top of your headrest. If the angle of the headrest adjusts, you should adjust it so that it is straight, not angled upward or downward. Your seatbelt should cross over at the center of your collarbone. Some cars have adjustable shoulder straps on the frame. This will allow you to move it up or down in order to move the strap to the proper position. The part of the seatbelt that goes over your lap should be low enough that it hugs your hip bones. The lap belt should not go across your stomach or abdomen. This can cause more damage in the event of an accident. The safest position for your hands on the steering wheel compared to a clock are either 9 and 3 or 8 and 4. This is a relatively new change, but it is important to remember because if the airbag deploys, your arms are less likely to be injured. This is also a more comfortable position and will reduce strain on your wrists, arms, and shoulders. Your rearview mirror should frame the back windshield, and you should be able to see directly behind you while keeping your head still and looking up into the mirror. In order to adjust your left side mirror, you should lean your head on the window and set the mirror to barely show the driver's side edge of the vehicle. To set the right side mirror, lean to the right so that your head is directly below the rearview mirror or above the center console. Then set the mirror to barely show the edge of the passenger side of the vehicle. By setting your mirrors this way, you can increase the area that you can see in your mirrors and have decreased the blind spots. It is important to know how to operate basic functions in your car, such as adjusting your headlights, turning on and off the windshield wipers, adjusting the temperature and radio, and opening and closing the windows. In order to be safe while using these functions, you should review where each of these are prior to driving and make sure that you are familiar with them. Refer to your car manual for this information, as all cars are different. It is also important to keep your tires inflated to an appropriate pressure and ensure that the tires still have enough tread on them and that they are not too worn down. There are many resources on the internet that can teach you how to determine if you need new tires, as we do not have time to discuss that much in depth here. One more important thing to check is the headlights. Make sure the headlights in your vehicle are still working and clear. Once they become clouded, you will need to change your headlights or have them changed.
After reviewing safe transfer techniques, adaptive equipment, and proper positioning in the car, we hope these tips will help you to stay safe driving and riding in the car. Thank you for allowing us to share these tips with you today. If you have any questions or would like to meet with someone to help learn safer transferring or use of adaptive equipment, you can contact Parkland College Life Clinic staff Kendra Schroeder by phone or email. Thank you again for allowing us to share some safety tips with car transfers and driving. Have a nice day.